Welcome. What can I do for you?
I have been coughing and experiencing shortness of breath.
Let's start with a few questions. Tell me about yourself. We need to know a little before we get started.
My name is Tim. I am 53 years old. I have smoked for 36 years. I exercise sometimes, but not often. I'm a retired coal miner.
It sounds like you may have emphysema. Let me explain.
Emphysema is when the walls inside the alveoli rupture, creating a large hollow space and decreasing the surface area for exchange of gases. Emphysema is a progressive form of chronic obstructive pulmonary disease, also known as COPD.
At the end of the bronchial tree sit grape-like clusters of alveoli that are sites of gas exchange. These structures are wrapped in capillaries as well as elastic fibers. These fibers provide structure to alveoli and aid in expansion and contraction while breathing. The walls of the alveoli are primarily simple squamous cells, which are type 1, but another type of alveolar cells, type 2, are present that are simple cuboidal cells. These cells secrete fluids and antimicrobial proteins that play a role in immunity. Alveolar macrophages patrol the surface of the alveoli due to the high risk of microorganisms entering the respiratory tract. These leukocytes produce an enzyme called protease that plays a role in killing bacteria and digesting proteins. Protecting healthy tissues from the enzyme, an anti-protease enzyme called alpha-1 antitrypsin is present.
Emphysema damage occurs to the elastic fibers and the alveoli walls, leading to lack of support for exhalation and inhalation, as well as decreased surface area of the alveoli. The results in lower amounts of gas exchange, causing deficient amounts of oxygen. In the diagram, you can see large pockets forming and decreasing surface area. The lack of elastic fibers leads to trapped deoxygenated air in the alveoli, also contributing to lack of oxygenated air being exchanged. Damage is caused by one of two factors. When smoke or other irritants are inhaled, it triggers an increase in leukocytes to be brought to the area. These cells produce the enzyme protease. The enzyme protease starts to be abundant, and there is insufficient amounts of antiprotease enzyme to neutralize the effect. It begins to break down the healthy elastic fibers and other healthy tissue. Other than smoking or exposure to other irritants, a genetic condition can contribute to the development of emphysema, where the body doesn't produce enough antiprotease enzyme to provide protection to the tissue naturally.
These two different causes are diagnosable as two different types, centracinor and panacinor. Centracinor is the most prevalent in smokers, which damage occurs first in the bronchioles. Panacinor is most common in people with a genetic condition. Damage occurs first in the alveoli. A barrel chest is caused by the hyperinflation of lungs due to the inability to exhale excess air. Shortness of breath and cyanotic lips are due to the body not receiving adequate amounts of oxygen. Coughing is caused by the inhalation of an irritant, such as smoke, that causes the emphysema as the body tries to remove build-up toxins from the lungs.
Risk factors for emphysema include smoking, age, exposure to secondhand smoke, exposure to workplace fumes and dust, and pollution. Typically, emphysema is diagnosed by the use of a spirometer. This measures the amount of air being exhaled. People with emphysema have less air expelled due to some of it being trapped. Treatments includes O2 therapy and some medications to help lessen the symptoms, as the damage done to the lung is irreversible.
Homeostasis is disrupted by emphysema when the O2 levels in the body are disrupted due to insufficient gas exchange. Also, respiratory acidosis may begin to occur as a result of poor respiration. Hydrogen levels begin to rise in the blood. Abnormalities in the proteins is essentially what causes the harmful effects of emphysema, as the damage begins to occur when there is too much protease enzyme or too little antiprotease enzyme.
Tim was prescribed an inhaler. His doctor was in contact with Dr. Christina Ladzima at the University of Pittsburgh's Emphysema Research Center. She suggested, according to recent research, that in addition, a daily dose of erythromycin to prevent symptoms by decreasing inflammation and risk of infections.
Created using Powtoon.